This is the Gordon Center for Research in Medical Education. My name is Vivian Omesso. I'm an internist. Before, I'd like to welcome you first to our center. We're very happy to have you here. And I'm sure, as you know, this is the place where you will be starting your clinical medicine course as of August 4th, 2009. So I'm very happy to meet you and eager to show you our center and let you know a little bit about what you're going to do here. This room right across. You guys will be taking part in an airway course in the 3rd year of medical school. That will take place here.
Doctor's really fine.
Is it full?
No.
No, right?
That would have been very.
Yeah. When Dr. Gordon started here, this was his main simulator that he invented, the cardiopulmonary simulator. Some of you are familiar with. Over 200 medical schools have a heartbeat in their facility, as well as the UMedic programs that we developed. He's made here, and I'll show you where he's made and distributed. But again, our main how we started was in cardiology, so we're going to have extensive teaching in cardiology during your clinical skills curriculum. The clinical medicine, the basic foundation of what we're going to teach you guys is how to become competent doctors. So it's going to be, I think, really exciting to be learning here in an environment where you're going to have a lot of hands-on experience. And then we have them walk over to the simulator in order to see if they can diagnose findings. You probably won't be doing that until you're in the more advanced phases, most likely clinical medicine 2 during the 2nd year and during your clerkship years, but definitely you will be having some standardized patient sessions early in the curriculum and during period 1, and you will have some sessions with Harvey as well in period 1. And period 1, I mean starting August till March, and then definitely much more standardized patient sessions come period 2, where you will be in your system modules, and hopefully for those organ system modules, you will be having standardized patient sessions that correspond and are aligned with what you're learning during that module.
It's not going to be till the 2nd year, I'm assuming, where you start doing the physical of prostate.
You're going to be having the
things of that nature.
Well, you will be having standardized patients during period 2, but you will have a session with standardized patients during period 1 in year 1 once you've learned the history, because you will be practicing your history taking skills. You will be practicing for multiple sessions between yourselves, peer to peer, but then we will have 2 sessions, or 1 session actually, where you're going to be videotaped. Actually, once we feel that you're ready, you're going to be practicing doing an interview. And then the session following that, you're going to be with your facilitator in your small group, watching pieces of that interview and getting feedback. Learning the female and male physical examination, which is examination of the prostate and things like that. And we will most likely be doing those with professional patients who are experienced and practice in doing those exams, and you'll be doing them in small groups. We will also have simulators or task trainers in the ophthalmic exam, the head and neck examination for the ear exam, and a female, male, and a prostate task training that you'll be working with as well in the center. We're going to provide you with checklists so that you can have always those checklists with you until you learn the exam well, and then you will be tested with standardized patients at the end of period 1 with an OSCE type format on the complete history and the complete physical exam. So by the end of period 1, you should know how to obtain a complete history and do a complete physical exam, except for the female and the male exam, which is not going to be until period 2. And so you should feel comfortable that you'll be comfortable with that by March. I promise you. Okay?
What you don't want to do is to underestimate these standardized patients, because they're good. They're very good. And it kind of gives you this little bit of security in a non-patient, so to speak, before you get to the real thing, and it's worth every minute you spend in it.
Yeah. you'll be learning, and it's not to get, you'll be learning, you'll have plenty of, there's going to be 8 sessions in the communications, where most of those sessions will be in small group with a facilitator, going through the dynamics of taking history and then practicing amongst yourselves with role play before we throw you into a standardized patient interview. So interesting part, I think it's just going to be you're going to get major hands-on sessions. You're going to be working. It's not going to be an experience where it's just going to be read the text and kind of get lectures. You're going to be made to play the role and made to practice, and that's going to be the best, I think, part of the course. And the other, I think, best thing about this is that Harvey has been here, and we are experts in teaching the cardiac exam. So you're going to get teaching from very, very, we do this all the time. So you're going to get, I think, very good, very strong teaching as far as the cardiac examination as well. And especially, I think that you're going to get teaching all around, but cardiology, neurology, and emergency medicine, we just have excellent tools that you're going to be able to use. And the important thing is not just having the tools, but knowing how to develop the curriculum around the tools so that the tools are effective. Because many places may have all the tools, but if you don't have the curriculum that makes the tool worthwhile, it's not effective. And that's what we are experts here in. We develop curriculum, and that's what we specialize in. We're educators. So I think that you're going to get a very strong academic teaching experience here at our center. Experience, I think, will be the OSCEs. I promise it will be stressful. I think but I think it's going to be a learning experience, and we're going to give you enough practice sessions so that.
Can you define what OSCE is? Because some of the students don't know.
I'm sorry. The OSCE is the Objective Structured Clinical Examination, which is the way that Dr. Ron Harden, who is a very well-known educator, he developed the OSCE. And the reason why the OSCE was developed was because they found that it's very difficult to assess a competent doctor. How do we test how someone takes history? How do we assess how someone does a good physical examination by paper with multiple choice questions or filling in the blank or true and false and things like that? So it wasn't adequate, so they developed this objective structured clinical exam where you're actually put in a specific situation, given clinical data, and observed. And then one of the other important parts is also giving feedback. So it is nerve-wracking for students, especially when the OSCE is for end of the year assessment, okay, or end of third year to go on to fourth year assessment. But it is a true learning experience because it puts you in that clinical situation where you're actually asking the questions, dealing with the patient, examining the patient, and then you're getting the most important thing, so that you're getting the feel of being in that situation. And the most important part of it, I think, is that you're getting feedback at that time, and you're just and you're developing also self-awareness. How can I improve my skills? Because sometimes not everyone is aware of things that they're good at or things that they're not very good at. And it's a very important time to be able to point those areas of weakness or those areas of strength out. You can put them on. You can flick it on the side and put it up. Oh my gosh! So you're listening to cardiac sounds. You hear them looked up. Yeah. And here's a new. And so that's just a little example that I just want to show you. There's still one. Here. So here's mitral regurgitation. I'm sure you guys have seen.
We have put together a curriculum that I think is as good as any medical school in the country. I'm kind of biased. I think it's even better. And the reason for that is that when you finish your medical education at FIU, you're going to have a keen understanding of the challenges that men, women, and children in this country have in accessing the healthcare system, and the impediments that you have as medical providers to actually getting that care to them. The country is very much preoccupied with medical education reform now. We're even sort of looking at Canada as an actual leader in this area, because you cannot have a new school of medicine in Canada without having a social directive, something that actually makes a difference for the community where you educate your medical students. So you're really on the forefront of, I think, a major change in this country as to how we're going to be educating medical students in the future. And I think you'll get a nice balance of understanding the benefits of specialty care versus primary care. So in terms of the exposure that you're having as you go through each year, you guys are going to be so spoiled when you leave FIU. You're going to be treated so well. And they're going to go, wow, that was really great. I really enjoyed this. I want to do it again.
Trumps any other medical school, hospital.
Have you visited other medical schools?
Yeah, but they have definitely been the most warming so far and welcoming. So we already feel like family. It's crazy.
Yeah, let's
Get a lot of attention. That's right. Ready? There we go.